Welcome to Health Connection with Kettering Health Network. I'm Chris Wilgus. I'm here today with Dr. Jaleh Eslami, a plastic surgeon with Kettering Physician Network who practices here at Kettering Medical Center. Thank you very much for joining me, first of all.
Thank you for having me.
We're going to talk about breast reconstruction after a breast cancer diagnosis, after the treatment. It's something that you see quite often, right? How often does that come into play for you?
We generally see a couple patients a week. So it's on a weekly basis that we see patients and discuss the reconstructive options with them. So
basically, breast reconstruction is after the mastectomy or after any kind of treatment is over, what do you do?
Generally, what we like to do is see them before they have their mastectomy, and then it saves them a surgical step. So when they get their cancer diagnosis, they see the general surgeon who discusses their surgical option as far as their breast is concerned. And they generally have two options as far as that's concerned. One is a mastectomy, which is total removal of the breast, or a partial mastectomy or a lumpectomy. Those are their general surgical options. And when they have had that discussion with their surgeon, then we'll see them and discuss their reconstructive options. This is before they've had any surgeries. And what we call this is an immediate reconstruction. In other words, when the patient wakes up, they're not completely without a breast. They have something in place. And from a psychological standpoint, that tends to be a lot better for women. And so they have a couple of reconstructive options. If they're going to have a mastectomy, which is the total removal of the breast, we'll discuss what options we can perform for them. And the latest trend in plastic surgery is to address those women who are having the partial mastectomies, which in the past they would just get their lumpectomy or their partial mastectomy, and they would get radiation, and they would have these large deformities of the breast because after the removal of the lump or the breast tissue and radiation, that area would just get contracted and scarred down, and they could never fit in their clothes well or anything else. So that's the newest trend towards the reconstructions.
You've seen a lot of developments, a lot of changes in this field. What kind of new developments do you have in breast reconstruction?
Well, there are a couple of new developments. For a complete mastectomy, some of the newer developments are the free flaps, which basically they take tissue from one part of the body and put it on another part of the body. And that's one of the newest things that have come along. The other new developments are the partial reconstructions. In other words, when women get part of their breast removed, we can reconstruct it and have the other breast to match it to equalize both breasts. So when they wear a bra or wear their clothes, there isn't a big deformity. And a lot of women that I see, they notice it more when it's in a bathing suit or something that cannot be camouflaged, unfortunately.
To learn more, visit ketteringhealthnetwork.org. Watch for more of these video podcasts, subscribe to the audio version on iTunes, and get in touch with doctors like Dr. Eslami on ketteringphysiciannetwork.org. Thank you again so much.
Thank you.